Now we will discuss vitamin B12. Vitamin B12, it is also called as Cobalamin. Function, it is a cofactor for methionine synthase, transfers CH3 methyl group as methylcobalamin, and methylmalonyl-CoA mutase important for DNA synthesis. Vitamin B12 is important for DNA synthesis. Vitamin B12 or cobalamin, it is found in animal products. Vitamin B9 was found in leafy green vegetables, and vitamin B12, it is found in the animal products synthesized only by intestinal microbiota. It is only synthesized by microorganisms present in the intestines. Site of synthesis in human as is distal to site of absorption. So in the human being, its site of synthesis is ahead or distal to where it is absorbed. Thus B12 must be consumed via animal products. So animal products are important for vitamin B12. Deficiency or decreased level of vitamin B2, they cause macrocytic megaloblastic anemia. Macrocytics are very large size cell, and megaloblastic anemia causes decreased number but very large size of cells and hypersegmented polymorphonuclear cells. Paresthesias or tingling and subacute combined degeneration of dorsal columns, lateral corticospinal tracts, and spinocerebellar tracts. So it also affects these central nervous system organs, dorsal columns, cerebral tracts, and corticospinal tracts due to abnormal myelin associated with increased homocysteine and methylmalonic acid levels along with scanty folate deficiency. Prolonged deficiency of vitamin B12 leads to irreversible nerve damage. Irreversible nerve damage happens because of prolonged deficiency of vitamin B12. Very large reserve pool, several years stored primarily in the liver. Deficiency caused by malabsorption, for example, sprue enteritis, Diphyllobothrium latrum, achlorhydria, bacterial overgrowth, alcohol overuse. Lack of intrinsic factor, for example, pernicious anemia, gastric bypass surgery also causes vitamin B12 deficiency. Absence of terminal ileum, surgical resection, for example, Crohn disease, certain drugs, for example, metformin, or insufficient intake, veganism, or decreased intake of animal products, or mostly consuming vegetarian diet. It also leads to decreased level of vitamin B12. Vitamin B9 folate supplementation can mask the hematologic symptoms of vitamin B12 deficiency, but not the neurologic symptoms. Vitamin B9 and B12 have same hematologic symptoms like macrocytic megaloblastic anemia, hypersegmented polynucleocytes, but vitamin B12 deficiency also cause neurologic symptoms by spinocerebellar tract, corticospinal tracts, and abnormal myelin. Vitamin C. Vitamin C, also called ascorbic acid. Function of vitamin C is it is antioxidant. Also facilitate iron absorption by reducing it to Fe2 plus state. Necessary for hydroxylation of proline and lysine. In collagen synthesis, it is very important. Vitamin C is very important. It is necessary for dopamine beta hydroxylase. It converts dopamine to norepinephrine. Vitamin C is found in fruits and vegetables, mainly in the citrus fruits like oranges. Vitamin C is present. Kiwi is very good source of vitamin C. Pronounced is absorbic acid. Absorbic acid is like, it's mnemonic, absorbic acid and ascorbic acid. Ancillary treatment for methemoglobinemia by Fe3 plus to Fe2 plus. It is converted to Fe2 plus state in the treatment of methemoglobinemia. Deficiency of vitamin C or ascorbic acid, it causes scurvy. Scurvy is swollen gums, easy bruising, petechiae, hemarthrosis. Easy bruising is very easy coming of bleeding from skin. Petechiae are small purple colored like pinpoint marks on skin. Hemarthrosis is like bleeding in the joints, anemia, low blood cells, poor wound healing, perifollicular and subperiosteal hemorrhages. These are in the joints, and corkscrew hair, where hairs are like corkscrew like and very round shape, abnormal shape, and it also causes vitamin C deficiency, also leads to weakened immune responses. Deficiency may be precipitated by tea and toast diet. Like if we it meaning is if we only eat, if we don't eat fruits like citrus fruits and vegetables, and only eat other fast food things, it may be precipitated. It can lead to vitamin C deficiency. Vitamin C deficiency causes scurvy due to collagen hydroxylation defect. So we will discuss about impacts of excess vitamin C. So if vitamin C is high, it leads to nausea, vomiting, diarrhea, fatigue, calcium oxalate, nephrolithiasis. So nephrolithiasis, kidney stones, calcium oxalate kidney stones are due to excess vitamin C, diarrhea, vomiting, and nausea. Excess oxalate from vitamin C metabolism can increase iron toxicity in predisposed individual by increasing dietary iron absorption, can worsen hemochromatosis or transfusion related iron overload. Okay, I hope you can understand this. So we have discussed vitamin C, its deficiency and excess and scurvy, etc.